So it's officially the day before my surgery, which is scheduled tomorrow morning at 9 a.m. California time. And let me just start this video off by really saying rest in peace. I will miss you. Ugh. I had to freaking get my nails off for surgery. I'm like, ugh. Well, surgery, because they're always talking about, like, when you have acrylic nails, you can have, like, bacteria growing and all that stuff. So, everything needs to be sterile, whenever I'm taking care of the new stitches that I'll have on this side, my right side. I guess the stitches it's like going to be like how they explained it, like this, and then like this. So, and something like that, like, because the new skin that they graft on you, from your back. So, thank God for my aunt who is going to be staying with me the whole time I'm at the hospital, which would be a minimum of 2 days. Could be longer, but it's literally a minimum of 2 days. I mean, they don't want you to stay at the hospital for too long because you can get sick, from other people when you're at the hospital. So hopefully I don't have any complications like I did last time. Last time I went to, when I had my double mastectomy, because of surgery and I was out and under anesthesia for so long, I guess I had a reaction or something, some like fungal something in my mouth. And they couldn't like figure out like what it was. Like I couldn't eat at all. So I literally ate applesauce a lot. And they kept trying to give me like different rinses and stuff or whatever to try and help. It's like, I don't know. I couldn't really figure it out, and they couldn't really figure it out. But I guess they said it happens sometimes, like when you're out under anesthesia for so long. So this time my surgeon said, thanks for letting me know. Like, there's something that I can, like, give you. I don't know what, like, before surgery. I'm not quite clear, but, hopefully, like, I'm nervous about that. I'm nervous about what my chest is going to look like. Because obviously, like, I'm not going in to get, like, my breast instantly. Like, it's a process, but it's just, when I first saw myself after my double mastectomy, I literally was crying. Like, it's like, I took a picture of myself when I first saw myself in the mirror, and I couldn't hold back crying. Like, it was just like, oh my God. Oh my God. The scars, the drains. This time, last time, when I had a double mastectomy, I had 4 drains, two on each side. Drains are basically like these, like, tubes or whatever that come out and they catch, like, all the like fluid and stuff that, like, drains out of your body, and it comes down, like, tubes come down, and then at the end of the tube is like this bulb or whatever that uh, has like red stuff, like tissue, whatever, drains out of you. So this time they said that I'm going to have 3 drains. So it will be 1 drain coming from this side down, and then 2 on my back where they're making the incision to get the muscle and fat. And then, so then I'll have like the 3 drains, and then of course the bulb, and then of course they give you a log, and the log, you have to, I think it's like every morning, mid-afternoon, and night, you have to constantly like record how much fluid is coming out. And so it's like a daily tracker. I mean, can you speak, Ashlyn? Clearly not. A tracker that you do, and then you take that every week to your surgeon, and in my case, my plastic surgeon, and then he'll gauge by like if the fluid, when the fluid's getting less, then that's whenever he decides how and when to take out the drains. In a dream world, for me, I wouldn't have to have the drains at all, because the drains are a pain in the ass. There is no other way of saying it, a cute way of saying it. Having tubes coming down or whatever, and bulbs, and I got this little belt or whatever, like, that I bought from Amazon, before my mastectomy, that I put the bulb in so that the drains aren't just like hanging and like pulling on your skin. So yeah, anyways, I'm not looking forward to the drains. I'm definitely not looking forward to being under anesthesia for 5 hours. The whole thing is like nerve-wracking, but I guess whatever, it's like in life, you always have to take chances, to get what you want. And sometimes, like, your idea of what you want doesn't always pan out. So all you can do is hope, pray for the best. Yeah, I mean, like, everyone is asking me, like, are you nervous? Do you have a lot of anxiety? Because I do have anxiety, in general. But it's like they say to keep your stress levels down and stuff before surgery. So I guess I just don't really think about it. I just kind of keep it as like a routine. Like, it's like I've done surgeries so many times on my chest or whatever, like for the, from having cancer before, and this time of cancer. And the thing that I was trying to say in my other videos, like, I didn't get an infection per se, like, after the double mastectomy. It was that my right side of my chest, it wasn't closing, like the skin wasn't closing, regardless, like, of how much wound care and like the doctor and stuff, like, it wouldn't close, it wouldn't like heal and like form, like the scar or whatever. So that's why they had to take out this expander. So I had to go in or whatever for another surgery to get the expander out. So that was like my big complication from that. I'm also trying to quit vaping nicotine, not drug vaping, but like nicotine vaping. And that's like, really hard and like super hard because, yeah, I have like an oral fixation. It's like every time I'm like vaping, I do all the time. I mean, like, I think I've vaped like outside of church, maybe in a church bathroom. Uh, yeah, like I've vaped in the ER before. I've vaped in movies. Like I vape even when people don't even know I'm vaping because, I'll pretend like, I'm looking in my purse like, oh, just gotta look at my big purse or something. Like, where could it be or whatever? And I'm like, okay, or whatever. So, like, it's like, I vape all the time. So it's like so hard to like stop something that it's like second nature. But I guess if I could quit using drugs and alcohol and quit smoking cigarettes or whatever, like, I guess whatever, like, hopefully, I can quit vaping. I'm even thinking about vaping right now, but to take away the desire and want for that nicotine vape, I officially took all my vapes and like dumped them in the dumpster. So, hopefully I don't get that big of a craving where I'm like, guess I'm going dumpster diving, because that would not be good at all. So I figured if I dump him in the dumpster, I'm like, diseases, can't have any diseases before surgery or whatever. So, yeah, like, leave it in the dumpster, girl, and just keep it pushing. So, yeah, so that's that. I'm gonna try and somehow do a video tomorrow right before my procedure. I hope my blood glucose, sugar, whatever level is like good enough for me to get, both of the things done tomorrow, like the flap surgery and putting back in the right expander. I just hope, pray, like, ooh, like I just, I feel like I've been doing so much trying to like get there. And I just hope and I pray that everything works out the way that it should. And so it's just like, that's all I can think about. I can't stress about it anymore. There's nothing else I can do that I haven't done already. I mean, I'm a sweets junkie. I love, love, love candy and sweets and cakes and cookies and pies. Like, you name it, sweets or whatever. Like, oh my god, chocolate peanut butter is like, oh, heaven or whatever. So, yeah. I cut it all out. For the like last few weeks, I haven't had anything. I haven't had a fried food. I haven't had a fried chicken tender, a hamburger, like a taco. Like, I haven't had anything, whatever. Like, I've like really been trying to like do everything that like, was saying that would, help me with the blood glucose sugar. I don't really understand, like, is it blood glucose sugar level or is it blood glucose level? I don't know. Like, I really don't know. But yeah, I really enjoy making these videos. The first one that I made was a little like, like rocky because it's like, oh my god, like, how do I do this? Like, nobody's interviewing me, nobody's, whatever. So I told my friend, because she said it would be hard for her to make a video, and I'm like, Honestly, I just like look at the webcam and pretend like I'm talking to somebody. And yeah, so I guess that's just how I like look at it. And I know that the internet can be like very negative, like have negative comments, like people can comment on your looks, what you look like, how you sound, how you present yourself, you know. But I feel like, it's just like people hiding behind their computer screen. Like I don't hide behind this. Like especially like, like dating apps. Like I've tried dating apps. I mean, who hasn't tried dating apps? But dating apps suck, and all you get is just a lot of people like trying to fetishize you because you're transgender, or like you just have people like telling you to off yourself, or that you're fat, or that you're not female, or you're not this, you're not that. I can handle it. I mean, I'm not gonna say that it doesn't like bother me, but it doesn't make me want to do anything drastic and like in myself, because the internet doesn't like me, or people on the internet, or people in the world. Like I still go out and conduct my life every day. Like inside I have insecurities, but I'm pretty sure lots of people in the world have insecurities. It's just that I'm blunt about having insecurities. And, this whole cancer journey has developed a lot of insecurities. I mean, I feel like I've gotten rid of like all the clothes I used to wear, like before my mastectomy, and now I'm just like t-shirts. And when I wear a tank top, like with the strings, the camis, whatever the hell we want to call them these days, I just wear them, but like put a sweater over it, even though it's like blazing hot outside. And yeah, I guess I just kind of do like whatever. I mean, sometimes like I can't like hide the fact that my chest is flat and concaved and the way it looks. But yeah, I don't know. I just keep putting one foot in front of the other and hoping at some point or whatever that, people, not all people, but at least one or two will see me doing these videos and take the positive from it, not, like, what is she wearing? What is it wearing? Or, any of the negative horseshit that people like to say. Back in the day, I wasn't a good person when I was in my addiction. I sure as hell or whatever, like, judged, people and this and that, but I've been going to counseling since the start of my cancer diagnosis, so about like a year and a half now, and I've changed extensively. I mean, I still have more changing, just like anyone, because we're never going to be perfect. We're always going to have something to work on. It's just that me, I could say I am willing to work on my faults, and I can't change how anybody else is, or how anybody else feels towards me, or how they treat my community, LGBT or trans. So, you know, every day we just got to keep pushing and put one foot in front of the other. And yeah, I recommend therapy for anyone. I mean, I told my therapist, I said I think therapists should have therapists as well. So, yeah. And with that, thank you for listening today, and peace out. See y'all tomorrow.